Okay, so here's our case number 2. Again, a little bit different of an x-ray. Again, going through our Paceman criteria. So the first one is position. Okay, positioning, again, we're referring to is the patient rotated, tilted, kyphotic, lordotic, etc. Now, is the patient rotated? Well, again, if you look at the medial borders of the clavicle, let's zoom this in a bit. So that's the medial border of the right one. That seems to be the medial border of the left one, and that's the spinous processes. Okay, if you look at the overall position of the thoracic spine, there doesn't seem to be much scoliosis. It's relatively straight, so we can kind of conclude. See how this distance is quite small compared to this one. Okay, we can probably say that the patient's left shoulder was a little bit closer to the board compared to the other side. So a slight rotation because of the medial ends of the clavicles are not equidistant from the spinous process. If you look at it overall, there is a slight asymmetry in terms of the positioning of the ribs as well. This one seems a little bit more sort of elongated compared to that side. That's another way that you can tell. Now, that's rotation. Is the patient tilted? So again, kind of zooming out, squinting your eyes a little bit, asking yourself, is the lungs tilted left or right? Probably not much significant, if anything, very slightly towards the patient's right, but it's very minor, so I wouldn't really worry about that one. The other question is if the patient is really kyphotic or lordotic. Again, I can see 1, 2, and roughly 3 ribs above the clavicle, so the clavicle positioning seems to be in an okay position. The angle of the clavicle itself is within normal limits, so I wouldn't say the shoulders are necessarily raised or lowered in any significant manner, and there doesn't seem to be much kyphosis or lordosis in that manner. The position of the scapula, again, so the medial borders are sort of within the lung field, which is not ideal. They should be rolled forward so they're out of the way. So that's something that's sort of covering the lung field in a minor manner. And I think that's pretty much it for position.